Hello, everyone. It's Monday, January the 24th, 2022. I apologize for us, being a little behind here and everything. I've been meeting with Congressman McKinley and on a lot of really important things that are happening and coming our way from West Virginia. Infrastructure possibilities, and whether it be broadband or roads or whatever, and a lot of stuff to talk about. And so again, I apologize for being a little late, but we've been meeting over at the mansion, and it ran over. But regretfully, we've got 36 more deaths. It's a whole heck of a lot better than it's not 110 or something like that, but still it's terrible, and so again, I always ask for your prayers. I mean, these are good people. We've lost good, great West Virginians, and their families, they need you. They need you bad right now. And if you could reach out, if you know them, if you could reach out, please do so. And if you don't, if you could just reach out in prayer, some way, somehow, they'll know that too. And but the 5,610th death in West Virginia is a 64-year-old female from Ohio County. The 5,611th death, an 82-year-old male from Berkeley County. The 5,612th death is a 96-year-old male from Brooke County. The 5,613th death, a 50-year-old female from Berkeley County. The 5,614th death, an 83-year-old male from Wetzel County. The 5,615th death, a 79-year-old male from Cabell County. The 5,616th death, a 78-year-old male from Grant County. The 5,617th death, a 75-year-old male from Ohio County. The 5,618th death, an 82-year-old male from Monongalia County. The 5,619th death, a 65-year-old male from Mineral County. The 5,620th death, a 66-year-old male from Lewis County. The 5,621st death, an 84-year-old female from Wetzel County. The 5,622nd death, a 79-year-old male from Raleigh County. The 5,623rd death, an 87-year-old male from Jackson County. The 5,624th death, a 71-year-old female from Mineral County. The 5,625th death, a 79-year-old female from Preston County. The 5,626th death, a 76-year-old female from Putnam County. The 5,627th death, a 73-year-old male from Lewis County. The 5,628th death, a 77-year-old female from Raleigh County. The 5,629th death, a 72-year-old female from Wood County. The 5,630th death, a 69-year-old female from Raleigh County. The 5,631st death, a 71-year-old female from Berkeley County. The 5,632nd death, a 63-year-old male from Berkeley County. The 5,633rd death is a 65-year-old male from Marion County. The 5,634th death, a 68-year-old female from Ohio County. Boy, this one, to see, we were buzzing along there, and really I kept thinking, well, the youngest person I think that I've called so far that we lost was a 50-year-old female from Berkeley County. But here's a 29-year-old male from Pleasants County. It's the 5,635th death. The 5,636th death, the 55-year-old male from Wood County. The 5,637th death, the 44-year-old female from Kanawha County. The 5,638th death, the 57-year-old male from Mineral County. The 5,639th death, the 72-year-old male from Fayette County. The 5,640th death, a 64-year-old female from Raleigh County. The 5,641st death, an 80-year-old female from Ohio County. The 5,642nd death, a 67-year-old female from Cabell County. The 5,643rd death, a 65-year-old female from Marshall County. The 5,644th death, a 71-year-old female from Wood County. And the 5,645th death in West Virginia is a 67-year-old male from Raleigh County. Oh my, oh my. I hate it for all. I just absolutely, it just really bothers me to go through all these people. I especially really hated to see someone, we've lost a 29-year-old. A 29-year-old male from Pleasants County. You know, daggone, it's just tough stuff. Before I go any further, though, let me just say this. This is a voice of a gentleman you see and hear all the time and everything. It's Hoppy Kercheval, and Hoppy has, from what I understand, has now been tested positive for COVID. I know he's fully vaccinated. And I don't know to the level of his symptoms at this point in time, but I want all of us to join in prayer and wish Hoppy a great and speedy recovery and everything. We'll miss him, you know, while he's out for, you know, however long it may be. But from what I understand, his symptoms so far are mild, and I'm sure that he attributes that just like I would have attributed it to if you weren't vaccinated. You know, it could be really bad. And in my situation, to be perfectly honest, I got pretty doggone sick for a couple of days and everything, and it wasn't any fun. But you know, with all of that and everything, I hope Hoppy's symptoms remain mild, and I'm sure that we attribute that to being vaccinated and him being boosted. So that's really good. Anyway, we hope and pray he'll get back real soon. We've lost another correctional officer. You know, this is the third correctional officer that we've lost due to COVID. A beautiful lady, Paula Joe Tomlin, 51 years old, had served at the Lakin Correctional Center since March of 2020. She had previously worked for the Division of Corrections and Rehabilitation as an employee in a medical, you know, as an employee of one of just, you know, the many medical providers and everything. She is from Middleport, Ohio, and is survived by her husband of 27 years, you know, and he is a Corporal Timothy D. Tomlin. So, and he is also a Lakin correctional officer. You know, this is the third death that we've had, you know, on staff, you know, of our correctional, you know, staff, you know, members or correctional officers, but we just hate it. Daggone, I just hate it. And I'll get to it in just a second, but we gotta. This thing is really, you know, I don't like to use words like raging, but we've got an awful lot of inmates and staff, you know, right now in corrections with COVID. Our active cases are now above 20,000 again, or 21,417. Our daily positivity rate is at 25.42. We had 3,378 new positive cases in the last 24 hours. Our cumulative rate is at 7.76. Recovered cases are a little above 395,000. But now we've got 976 patients that are in the hospital, 223 in the ICU units, and 104 that are on ventilators. We've got every county in our state that's red except 6 counties. Dr. Marsh, our coronavirus czar, the guy that we depend on with the knowledge, and you know, and all the people around him, General Hoyer and Dr. Amjad and Secretary Crouch, and on and on and on. They told us about this variant, you know, this Omicron variant that would absolutely run rampant all over the place. They told us and everything. And they've also told us this, that a way to almost ensure that you won't end up in the hospital. 976 people in the hospital now. A way that if you were to get this, that you can almost ensure yourself to not end up there, or absolutely not be one of 5,645 people that have died. The way you can absolutely ensure the best possible outcome for yourself is you got to get vaccinated. You got to get boosted. You have to. Okay, our National Guard still is doing terrific work, and they're backstopping us, and they're helping us in every way. As of this morning, we have 136 guardsmen that are working and deployed at 25 facilities, our hospital facilities, that they're helping us to, do the understaffing, and so we thank them over and over and over. As I've said, the Biden administration is offering home tests now, and you can go on our covidtest.gov, and we'll, it'll tell you how to get these 4 free tests. And if you want free N95 masks, they're also providing 3 free N95 masks per person, and that'll be made available late this week or next week at your pharmacies. I remind people again, 65 and older, you're looking at living testimony to that right now, but 65 and older with some compromising issues and everything. I've sure got some weight issues and everything, but if you get any symptom, you got to get tested. And hopefully we'll be able to get you the antibodies, and it'll save your life. From the standpoint of wearing a face mask, I've been over that and over that, We don't want any mandates about masks. We absolutely don't want that. But with, being smart, if you're going into a crowd of people indoors, you're 65 and older, and you've got all kinds of issues, whether it be diabetes or heart issues or whatever it may be, think about wearing a mask. I've told you a million times about getting boosted, and that's the one I can never understand. I have said it until I'm just blue-green in the face. But if you have been vaccinated, Pfizer or Moderna, 2 times, and then you decide in life, well, I'm just not going to get a booster shot, when you've got Dr. Marsh looking right at you, saying to you over and over that if you're 6 months out from your last vaccination, you don't have any immunity. It's like you decided not to be vaccinated in the first place. You have got to get the booster shot. You decided. You made the decision to get vaccinated. How can you possibly make the decision not to be boosted? But we got to get you to do that. Numbers haven't changed much as far as, we keep eking up just a little bit and everything, but the numbers, are 70.6% of people with 1 shot, above the age of 18, 82.2 over the age of 50, and 89.6 now over the age of 65. I encourage our young people to get vaccinated, and I ask our parents and grandparents to help us with that. All the information on our COVID vaccine info line is up there. I encourage you to take advantage of all the free testing, as I've done over and over and over. I always thank Fruth and Walgreens for all that they've done. We got 148 outbreaks in our long-term care facilities. I think we had 143 before. 2 in our church community in Kanawha and Nicholas County. But get this number. In corrections now, we have 559 inmate cases and 190 staff cases. Way, way, way up. I encourage you about getting the flu shot. You can do it at the same time as you're getting the COVID shot. We've still got that money available for our renters and our landlords if you just call us. I encourage you over and over and over about giving blood, and I ask you please to think about tuning in. We're going to give our State of the State address on Thursday night at 7 o'clock, and it'll be modified a little bit from the first go round, but we've got a lot of great news to announce in West Virginia, and we wanted we're rolling. We want to keep this thing rolling and keep it going in a great direction, and we're going to do everything in our power to do just that. But that's all I've got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. Excuse me, in support of what the governor has said, just as a real quick reminder, we know that with the Omicron virus spreading now as the dominant variant by far in West Virginia, our last sequencing run disclosed that now 94% of our most recent sequencing cases were the Omicron variant. So we know that this variant spreads very quickly. And as we mentioned last press brief, and the governor just reinforced that, the most important opportunity we have to reduce the pressure on hospitals and protect people from severe manifestations is to be fully vaccinated and boosted. If people are fully vaccinated and boosted at the 50 to 64-year-old range, their protection is 44 times people that are not immunized. And if you're over 65, your protection is 49 times greater of not having to be hospitalized. As we look at the world and try to get some perspective on what's going on with COVID-19, we see the advent of a second subvariant of the Omicron variant, which is the Omicron variant is the BA.1, which is the form of the Omicron that we have here, mostly in West Virginia, or have completely in West Virginia to my knowledge. But there's a second variant that has additional genetic changes, that is the BA.2, that is now gaining ground on the original variant in Denmark and has become the dominant form of Omicron in countries like India. Does not appear that there's more severe disease associated with it, although it's early. But this is a reminder that the virus continues to mutate, and it is to all of our best outcome and protection that we get vaccinated and boosted to try to reduce the new variants that will form. Interesting study out over the weekend discloses that men may be able to spread COVID-19 better than women or children because of the airway configuration and the way that men talk and breathe. But if people, women or children, scream or sing, then their production goes up over men. So it just reinforces the idea that in environments where people are going to be yelling or singing, that everyone can spread the Omicron variant of COVID-19. And it's important for us to consider wearing a high quality mask in those situations, both to reduce the amount of aerosols and droplets that are produced from somebody who may be asymptomatic and spreading COVID-19, and also for people who may be in that environment who would be protected against a high quality face mask. Otherwise, we are seeing the new cases in COVID-19 start to reduce in some of the more urban parts of our country where COVID-19, the Omicron variant, hit us first: New York City, Washington, D.C., some places in the Northeast. But it is important to recognize that the death rate has now climbed to almost 2,000 deaths a day on a 7-day rolling average, and that's the most since the beginning of the pandemic. So although there is some evidence at a person-to-person basis that Omicron might be less severe than Delta, the Delta variant, we know that overall the deaths are now going up, which is the last lagging indicator related to initially the RT value goes up, then cases go up, then hospitalizations go up, then severity of hospitalizations go up, and then deaths go up. And remember, West Virginia is tracking about 2 to 3 weeks behind a lot of places, and maybe a month to 6 weeks behind some of the very earliest places related to this current pandemic. Our hospital beds continue to go up in that 970 range. And for us, really, really important as we see staffing reduced at hospitals and healthcare facilities because of people getting infected with the Omicron variant themselves. Some people just getting tired of the daily challenge of seeing so many people sick and seeing so many people die. So it is really important for us to all pull the rope in the same direction right now. Thank you so much.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Highlight a couple of items that the governor had presented. Again, 25 requests for 27 locations for our hospitals. That will total initially what we have now 188 personnel. As the governor pointed out, a number of those are in place or going in place this week to those facilities. We'll continue to deploy personnel scheduled through the first week of February, and others that will be scheduled as well. As the governor pointed out, we did get some movement back again after 3 days of slowdown in vaccine numbers. We did get movement again back on first doses and boosters, but as the governor points out, just not fast enough. We need to get more West Virginians, particularly over the age 50, to get those booster doses as quickly as possible based on what Dr. Marsh has pointed out related to that. And as it relates to that, if you look a little bit more closely at the hospital data today, 34% of those hospitalized have been vaccinated. However, only 8% of the people in hospitals on ventilators have had a vaccine. So if you're unvaccinated and you go to the hospital, you've got a pretty good likelihood of going on a ventilator and having significant problems and potentially not making it out. So we've got to continue to get West Virginians vaccinated. Our numbers today, new admits in the hospital today, 108. We've consistently been over 100 for several days now, and that is going to continue to be a challenge to our facilities. There is no significant change in antibody availability. We continue to have challenges nationally with supply chain, and we work every day with our congressional leadership, particularly our two senators, to help us work through additional doses where they may be available to us, and we'll continue to make sure they are distributed appropriately across the state. Thank you.
Thank you, sir. Dr. Inamjad and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good morning, Governor. Good morning, cabinet members. You may have touched on this, but this is this another surge? I mean, this is a huge spike in cases, 3,000 new cases in the past day. We're nearing the pandemic high for hospitalizations. We're at 976 today. It was 1,012 back on September 24th was the pandemic high. We've surged. We dropped to about 15,000 active cases. Now we're back over 21,000. So is this the latest surge? What do you attribute this to? It's not like we had a recent holiday where a lot of people have been traveling and brought it back. Is it just the Omicron is so infectious and so contagious, more than the other strains? I'm just trying to get to the why of we're seeing these numbers spike again like they are.
I think, Dr. Marsh, you've got to answer this. You know, I could give it a whirl, but I think you're probably better than I.
Thank you, Governor, and thank you, Mark. Absolutely, we're in the midst of another surge that is caused by the Omicron variant. Remember, the Omicron variant has a spread capability like the measles did, which if you have a non-immune population would put that R value of about 10 to 12. And when we look at the difference between the spreading of Omicron and the infectiousness and Delta, we see Omicron is 2 to 3 times more infectious than the Delta variant. And it is so infectious that it can even infect people who have been vaccinated but are, over 4 to 6 months after their primary vaccination series, or people that have been vaccinated and boosted who are greater than 3 months after their booster dose. That doesn't mean that we lose protection on hospitalization or death, which is what we've talked about, 44 times protection against hospitalization in 50 to 64-year-olds that are fully vaccinated and boosted, and 49 times protection against hospitalization and death from people over 65. And if you're not vaccinated and boosted, and if you're not boosted, just vaccinated, that protection goes down to 17 times. So Mark, absolutely, we're in the midst of another surge. Our hospitals are at high risk because of the reduced staffing and the fact that many people are getting infected, many more people than we've seen before, nationally, internationally, and also in West Virginia. Thank you.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for General Hoyer. I know you said there had been no significant changes to our antibody supply, but could you be specific about what we're requesting versus what we're receiving, and then talk a little bit about how we make the decisions as to where across the state they get distributed? Thank you.
General, please go.
Yes, sir, Governor. So, Charles, we get about half of the total amount that we request, and what we do is a couple of things. Is we have some facilities that can order directly, such as hospitals, and then we will take a central supply and make those available to be able to move around the state when we have surges in specific counties or challenges that may occur within particular locations across the state. It takes a team of a couple of folks within the Interagency Task Force every day, about a full day, to continue to watch across the system and manage those movement of supplies across the system. Thank you.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, good morning, everyone. Thanks for taking the question. Dr. Marsh, have you read and do you have any reaction to an Israeli study that came out late last week, which indicated that even though the Israeli population is heavily vaccinated and has gone on to the fourth booster, which we've requested, but I don't think have received approval yet because I haven't heard anything about it, that they determined that natural immunity was actually more effective than the fourth booster, that for people who had gotten COVID, that their antibodies and the body's natural immune system was functioning better than the fourth booster shot did. Have you seen that? Could you comment on that? And also, could you give me a quick update on what's the latest we heard from the CDC about our request for the fourth booster for our population? Thank you.
Dr. Marsh, please.
Thank you, Governor, and thank you, Kenny. Kenny, there is evidence that in people that have been infected with COVID-19, and this is mainly the Delta and the Omicron variant, that for a period of time they do have persistent immunity. And in fact, you know, people that are infected and recover during at least the first 60 days to 90 days may well be better protected than people that are vaccinated and have never gotten COVID-19. But that also includes people that will die of COVID-19. So trying to get at that immunity can be problematic for at least a number of people. And as I said, we're seeing about 2,000 people die a day on average in the US, which is the most we've seen since the beginning part of the pandemic. That's a 9/11-like death event every 2 days. And we also know that vaccination is great protection for the most vulnerable part of our population. I think that there is debate, and there has always been debate about, you know, if you're younger and you have been infected and you have immunity, whether or not the vaccines are as beneficial for young people who have lesser risk of dying from COVID-19. But I think what we see today, particularly with our children, is that with the Omicron variant, there has been a significant uptick, about twice what we had seen before as far as hospitalizations. So I think that we certainly do know that natural immunity to a variety of different infections does give us immunity, which is important. And certainly in people that have recovered from COVID, that is a potentially positive thing. But unfortunately, a lot of people that choose to get COVID or that get COVID and don't protect themselves with the vaccination succumb to the consequences of COVID-19. And that accounts for about 870,000 deaths now in our country from COVID-19, which is really just stunning where the vaccines would protect almost each one of those people from having died. When it comes to answering the request that we made to President Biden and FDA CDC, to my knowledge, we have not heard a response. And when it comes to giving the last booster in Israel, what they saw was, and this has also been seen in the UK, I believe, that the boosters are not sufficient to stop the spread of the Omicron variant, given its highly infectious nature. And we're still waiting to see, as we anticipate, that the second booster will help reduce the severity of consequences in people that are farther out, 3 to 4 months from their previous booster, and who are highly vulnerable age or medical illness-wise. Thank you.
All right, thank you, Kenny. Next, we'll go to Jess Mancini with Ogden Newspapers.
Thank you very much for taking my question. I'd also like to join the chorus to wish Hobby a swift recovery. The question is there a number of hospitalizations when they reach a certain point when medical treatment for other emergencies is affected, such as a heart attack or a car accident or other medical issue? And do you anticipate that we'll ever get to that number? And when? Thank you.
I think Dr. Marsh and General Hoyer can answer, but I'll let them answer. They know better than I, but I can tell you that we're already at that number, in my opinion. I mean, I know of a situation that just happened. A great friend that had a stroke, and there was lots and lots of people in the hospital, lots and lots of COVID situations, and it was surely more cumbersome. Let me say that. But General, why don't you go first, and then Dr. Marsh, please.
Yes, sir, Governor. So, Jess, yeah, we are at that point now. We have a number of our hospitals that are operating at crisis standards of care right now. And Dr. Marsh can define a little bit more from a medical perspective what that means. But we do have procedures that are being put off. And again, I think it's really important to understand it is now not just a matter of capacity of beds in hospital, but it is a staffing issue as well, to include providers, important providers, who may not be available to do procedures. So it is a significant challenge to us at the state, and we have hit a point close to the maximum point of the Delta surge, and we believe, unfortunately, we're going to see that go beyond that, and it is going to continue to challenge our hospitals significantly. And don't forget, it also is challenging our emergency management system, our ambulance system, our long-term care facilities. I'll turn it over to you, Clay.
Thanks, Jim. And I'll just add the 3 levels of standard of care are conventional, which is basically where all of the evidence-based practices, nursing ratios, staffing is normal in our hospitals. Then there is a contingency standard of care where there are some alterations to those ratios and some of those practices, yet still maintaining full slate of surgeries and other procedures and care. And then there's crisis standards of care, where then certain certain elective procedures are stopped, as Jim Hoyer mentioned, and ratios of nursing and other evidence-based practices are not able to be followed because of the severity of the surge on hospital systems. And as Jim and the governor talked about, we are at that level. I think people should feel reassured that we still can provide all of our absolute emergency services to people. But the problem is, as we get more and more full, then there's harder times moving people through the system, kind of like Lake Pontchartrain in New Orleans, backing up a lot of the tributaries. And so we have worked very hard with our hospital leadership to continue to support them as we've talked about with National Guard members and others. But that's the reason why it's so important for all West Virginians to run to this fire and pull the rope in the same direction by please being careful right now, get vaccinated, get boosted, wear a mask if you're out, because this is a critical next 3 to 6 to 7 weeks for our hospital systems. And we all believe we're going to exceed our all-time high at a time that staffing's shorter and hospitals are more challenged today than even during the Delta pandemic. Thank you.
All right, thank you, Jess. Next, we'll go to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Fellow journalists, we're celebrating a little bit today at WCBC. Our general manager, Mary Kleitz, is back in the building after 5 months after suffering from COVID and also losing her son, 36 years old, to the disease. So we're a little melancholy, but we're happy to have Mary back. Has there been a way determined if the holidays had any spike associated with COVID, or is Omicron and Delta that infectious that we wouldn't know? It's just been that crazy since the end of the year and the beginning of this one. Thank you.
Clay, I think you got to do this, sir.
Thank you, Governor, and thank you, Paul. The Omicron variant is so incredibly infectious that although we certainly saw an increased number of cases after the holidays, we didn't see the same jump that we had seen in previous surges of this pandemic. And again, you know, as we go forward, we know that Omicron now has an ability to infect that is 2 to 3 times Delta, which was, you know, 2 to 3 times the UK variant, and spreads like the measles. So we are constantly getting people that are becoming infected with the Omicron variant. And as we talked about, you know, when you're around other people, that up in South Africa, up to 40% of people who were found to have Omicron were relatively asymptomatic. So Omicron spread is happening everywhere. And it's really important that we protect ourselves with full vaccination and a boost, and also really very much consider wearing a face mask, particularly if you're indoors, and try to be really careful for the next, again, 3 to 7 weeks or so.
All right, thank you, Paul. Next, we'll go to Kelsey Soto with WSAZ.
Good afternoon, everyone. I'm kind of hoping for an update on the National Guard's response. I know they've been utilized in previous parts of the pandemic doing testing sites and things like that. Can you kind of just give an update on, I know they've been working with hospitals, but seems like an increase in number of need. More facilities are requesting help. We've added another 50 or so Guard members since Friday. Do you anticipate needing more as time goes on, and how they're being used across the state?
General, please.
Yes, sir, Governor. So 25 facilities, 25 requests for 27 facilities, excuse me, to date. 188 guardsmen to fill those positions. They are either in position or being rolled out into position this week or the first of the following week. We have projected through our tabletop exercise up to 350 guardsmen needing to be utilized across the system, and they're providing support for everything from transporting patients to x-rays or procedures, and providing screening support in the entries to the hospitals, anything to relieve pressure off of providers to be able to go do direct patient care. Thank you.
All right, thank you, Kelsey. Governor, I'll turn it back to you.
Okay. You know, I take notes all the time, and right here you can see all the notes that I'm taking from just the experts and listening to them. I really want you to really listen, and maybe this message will only get to one person. And if it changes one person's opinion or viewpoint, and it helps one person, it's enough. But I'm telling you, it's frustrating. That's all there is to it. You know, I truly believe, and I believe with all in me, that it is your choice. It is our freedoms as to whether or not we want to be vaccinated or not vaccinated. I get all of that. I get that through and through. But can you imagine if you really believe that, how difficult it is to be here and listen to all of us say over and over and over, you got to get vaccinated, you got to get vaccinated. And really and truly we cling to the fact that we know that every day that we say this, somebody else comes across the finish line. Somebody else gets vaccinated. And a few thousand, you know, is really meaningful. A few hundred is meaningful. One is meaningful. And from all of that, I wish to goodness, I wish to God above in every way that I could tell you something else that we had in the toolbox that would help you. You know, now just listen to this and listen just a few seconds here. You know, through life, all of us have been told things like as children, maybe don't go over close to that old well because it's really dangerous and you could fall in, and if you fell, you know, it's 80 feet deep and it could very well kill you. Don't go over there. And yet, 36 people today, 36 people have probably gone over there. You know, from the standpoint of General Hoyer saying to us that 8% of the people that are vaccinated are on ventilators in the hospital. 92% of the unvaccinated folks that get COVID are the people that are on ventilators, 92% of them have never been vaccinated. I ask you over and over just to consider what all these great people are saying. Dr. Marsh, 44 times better, better odds if you're 50 and older. 49 times better odds if you're 65 and older. You know, you got a lot of folks that are spread across this great state that believe, well, you know, we're just going to live with this now. And to be perfectly honest, if you haven't gotten this, you would develop a different opinion after you've had it. You know, from the standpoint of myself, you know, I've had the opinion all along, we've got to get vaccinated. We have to get vaccinated. You know, there's no question that you know, we have made a response, you know, or we've asked for a response from the CDC in regard to the fourth shot. I can't recall if it was Kenny or who asked about that, but we've not received a substantial response at all. We've received just some lip service, but no substantial response to our request. You know, I've got to believe with all in me that you should pay real close attention to what I'm trying to tell you and what all of us are saying. A, we're in another surge. B, our hospitals are tasked to the very limit right now. C, is the Omicron virus is going to spread more and more and faster and faster. D, is your odds are phenomenally in your favor if by chance you get this, which there is a high probability that you could, but if you get this, the odds are phenomenally in your favor of not being hospitalized or, God forbid, death if you're vaccinated. If one person, heard me, one person changes, it's worth it. But I wish to God above, in every way, that we would really, really get at this. I know you may think, well, gosh, I just don't want to do it and everything. And I get that. I totally get that. And I respect that. with all in me. But at the same time, just think of all the consequences. Just think of the consequences of our hospitals. Think about that gentleman that I was talking about that had a stroke and absolutely started, was at the hospital and had all kinds of complications. Absolutely. For all of us, consider it. I'll be respectful and I'll stand rock solid right there. But I ask you to consider, because really and truly, we are in another surge. And this thing is spreading. And it's going to continue to spread. And I'm going to be right in front of you reading more and more and more of people that have died. And 90% of them are going to be unvaccinated. Stack the deck. Stack the deck in your favor, West Virginia. And just try to help us if you would, please. Thank you so much.